40,000 years ago, a man broke his leg in the middle of a forest. No hospital, no doctor, no painkillers. He survived. Not just survived, he healed completely. Archaeologists found his femur. It had snapped clean through, and it had fully mended. That kind of recovery doesn't happen alone. Someone kept him warm. Someone brought him food. Someone held the bone in place long enough for it to knit back together. A broken bone, 40,000 years ago, was a community project. But how did they actually do it? What did ancient humans know about the human skeleton that allowed them to save lives without a single modern tool? The answer goes deeper than you think. The human skeleton has 206 bones. Every single one of them can break. And the body's response to a fracture is immediate and violent. Within seconds of a break, blood floods the site. A clot forms. The immune system triggers inflammation so intense it can be felt from across the room as heat radiating through the skin. Then something extraordinary happens. Specialized cells called osteoclasts begin demolishing the damaged bone fragments. Right behind them, osteoblasts arrive and start building new bone from scratch. If the broken ends are held close together, they will fuse. If they aren't, the bone heals crooked or doesn't heal at all. The body wants to fix itself. It just needs the right conditions. Ancient humans figured this out without textbooks. They figured it out by watching. The oldest confirmed evidence of fracture care is approximately 50,000 years old. It was found in Shanidar Cave in northern Iraq, excavated by archaeologist Ralph Solecki in the 1950s. Among the Neanderthal remains in that cave was an individual with a healed arm fracture, a clean break that had fully fused. That individual had also lost the use of one eye and had a withered leg. He survived years in that condition. Someone cared for him. For years. Solecki called him Shanidar. Some researchers called him the first flower burial, because the site also contained pollen from medicinal plants placed deliberately in the grave. Neanderthals were nursing the injured and burying their dead with flowers. That's not the story most people learned in school. So what did early medical care actually look like? The first tool was stillness. Immobilization is the single most important factor in fracture healing. If a broken bone moves during the early healing phase, the clot is disrupted, the osteoblasts can't do their work, and the bone heals improperly or not at all. Ancient people learned this by watching animals. A wounded deer that kept running died. One that lay still sometimes survived. The second tool was splinting. Archaeological evidence from ancient Egypt, dating to around 3,500 years ago, shows the earliest confirmed medical splints in history. Discovered near the Nile, they were made from bark and linen, wrapped tightly around fractured limbs. Some were so well constructed they were almost indistinguishable from modern splints in function. The Edwin Smith Papyrus, written around 1600 BC, is the oldest known surgical text in the world. It describes 48 clinical cases. Case 35 describes a fractured clavicle. The recommended treatment? Rest. Immobilization. Padding between the shoulder blades to hold the break in position. 3,500 years ago, Egyptian physicians understood biomechanics. What about pain? This is where ancient medicine gets unexpectedly sophisticated. Willow bark was used across multiple ancient civilizations, Egyptian, Sumerian, Greek, to reduce fever and pain. It contains salicin, which the body converts into salicylic acid. That compound is the active ingredient in aspirin. The ancient world didn't know the chemistry, but they knew the result. Hippocrates, writing in 400 BC, recommended willow bark specifically for pain relief. 2,400 years later, in 1897, a chemist at Bayer named Felix Hoffmann synthesized the modern version of that same compound and called it aspirin. Ancient humans were using a version of aspirin for at least 4,000 years before we understood why it worked. How did ancient surgeons handle severe fractures? Bones that broke through the skin or shattered into fragments. This is called a compound fracture, and it was a death sentence for most of human history. Not because the bone couldn't heal, because the wound could get infected. Bacteria entering an open fracture site could trigger sepsis within days. Without antibiotics, sepsis is fatal in the majority of cases. Ancient physicians knew that an open fracture smelled different from a healing one. They didn't know the word bacteria, but they knew that certain wounds went bad, and they developed treatments that actually worked. Honey was applied directly to open wounds across ancient Egypt, Greece, and China. For centuries, this seemed like superstition. Then modern science analyzed honey and found it produces hydrogen peroxide when it contacts wound fluid. Honey is antimicrobial. It inhibits bacterial growth in open tissue. Ancient physicians were using a natural antibiotic. The ancient Greeks formalized bone care in ways that lasted nearly 2,000 years. Hippocrates described traction, the practice of pulling a fractured limb to realign the bone before splinting it. He described a device, later called the Hippocratic bench, which used a wooden frame and ropes to apply sustained, controlled tension to a fractured limb. This is the direct predecessor of orthopedic traction tables still used in trauma surgery today. Galen of Pergamon, working in the 2nd century AD, built on Hippocrates. He was the physician to Roman gladiators, a job that meant dealing with catastrophic bone injuries on a weekly basis. Galen observed fractures no ordinary doctor would see. He developed methods for setting bones using his hands alone, feeling for alignment the way a sculptor feels for the shape inside stone. He was right about enough of it that his methods dominated European medicine until the 1500s. Indigenous cultures worldwide developed fracture care independently, and some of their methods were strikingly effective. Native American tribes used hide splints, birch bark splints, and clay casts, the clay hardening around the limb like a rough plaster. Healers in ancient India, working within the tradition of Ayurvedic medicine, used bamboo splints wrapped with cotton and bound with herbal pastes designed to reduce swelling. In Papua New Guinea, researchers in the 20th century observed fracture care techniques that had no contact with Western medicine and found outcomes comparable to basic hospital care for simple fractures. The body wants to heal. Every civilization that paid close enough attention figured out how to help it. The first true plaster of Paris cast, the ancestor of every cast you've ever seen in a hospital, was developed in 1851 by a Dutch military surgeon named Antonius Mathijsen. Before that, for all of human history, the tools were bark, hide, linen, clay, and rope. And they worked. Out of the hundreds of ancient skeletons found with healed fractures, the vast majority show complete recovery. Not partial healing. Not crooked bones that caused lifelong disability. Clean, functional healing. The survival rates tell a story that modern medicine is only beginning to fully appreciate. Here is the part that changes everything. The oldest healed fractures in the human fossil record are not found in Homo sapiens. They are found in Homo erectus, our ancestor, dating back 1.6 million years. 1.6 million years ago, a creature that hadn't invented language yet, hadn't invented fire yet, was keeping its injured alive long enough for their bones to heal. Care is not a modern invention. Care is older than our species. The next time you see a cast on someone's arm, you are looking at the direct descendant of something a creature without language figured out in the middle of a forest 1.5 million years ago. We didn't learn to take care of each other because civilization taught us. We built civilization because taking care of each other was already in us.